Hello, everybody in podcast land. I'm Dr. Ted Thatchencary, and this is MD Roundtable, a podcast about collaborating and learning from other healthcare professionals from all over the globe. We are all so much more connected due to technology. We have so much to learn from each other. Thanks for joining us today at MD Roundtable. I am very excited as we are featuring Dr. Andres Henao, who is the infectious disease specialist and associate professor at the University of Colorado Anschutz Medical Center. He is also director of the travel clinic at the University of Colorado. Welcome to MD Roundtable, Andres.
Thank you so much for having me, Ted. It's a pleasure to be here.
Great, fantastic. First off, Andres, is it okay if you talk about your journey a little bit, where this all started? Like, where were you born? Where'd you come from?
Yes, absolutely. I'm originally from Colombia. I was born in a city in the southwest, Cali, Colombia, where I grew up, and I actually did my medical school. I had a lot of training, and a lot of exposure to infectious diseases early on. I used to see some HIV infection, tuberculosis, some tropical medicine. Then I went to and did a social service, a rural year in a small town close to Cali, a city named Restrepo. I spent a year there, and I saw a lot of rural medicine and a lot of also affected minority populations, especially with infectious diseases. Then I decided to do my specialty training in telemedicine, so I had the fortune to match the UT in San Antonio, Texas, where I completed my 3-year residency in internal medicine. And then from there, I came here to the University of Colorado to do my infectious disease fellowship. And after I completed my fellowship, I had the privilege to join as faculty. And it's been a little bit more than 10 years as a faculty with the ID division. And now I'm an associate professor and also had the fortune to be the lead for the global health for the Department of Medicine.
Great, that's fantastic, Andres. So it kind of sounds like you had an early exposure to infectious disease in Colombia, and that kind of triggered your interest in infectious
That's
disease,
correct.
correct?
Yeah, a lot of the patient population that I used to see when I was in training, and also some key mentors that were infectious disease specialists that drive the passion for the field.
Great, great. So, Andres, I understand you've spent some time in the Amazon. I'd like to get to that in a bit, but Andres, I got to tell you, I've always had this fascination of going to visit the Amazon. However, the Amazon scares me. I feel like everything in the Amazon is trying to kill you or swallow you
Yeah,
alive.
you might be right. It's a human nature to be afraid of
Yeah,
uncertainties and obviously places that we are not very familiar with. And so I also share that apprehension a little bit.
sure, sure. Yeah. Speaking of, I mean, do you want to tell us about your experience in the Amazon and what you've done and what you've seen there? This episode is brought to you by Primal Steak. They offer Texas pasture raised beef without any antibiotics, hormones, or chemicals. They offer a variety of cuts for you home chefs. If you enjoy grilling, this is the company to order your steak from, folks. They offer steak delivery directly to your home. Check them out at www.primal-steak.com. Once again, primal-steak.com. I guarantee you'll like it.
Yeah, I had a great experience, and it was such a learning, vibrant place to be, both for my medical knowledge growth and also as personal, since even I'm from Colombia, and there is part of the Amazon that covers some area in Colombia. Actually, this was my first time visiting the region, essentially came up as educational efforts. We have a network of infectious diseases specialists practicing in the United States, but we are Hispanic, so we have roots back to our own countries, so including Mexico, Panama, Honduras, Peru. And through that network, we wanted to support a talented group from University of Amazonia, where they are developing a relatively new but very innovative tropical medicine course, the LAPAS course, at the University of Amazonia in Iquitos, Peru. And so, because they were new and we all shared the same interest in tropical medicine, we wanted to travel there
Mhm.
and give support through some lectures, some teaching, actually trying to give advice how to make this course better, how to improve it, and how to take it to the next level. And so we have colleagues from Sony Brooks, Luis Marcos, that is an idea specialist there, and also the fellowship program director, also Carlos Franco with CU in Fort Collins, and Nelson Agudelo, he's in Oklahoma. And we had the fortune to travel there to support the local physicians and help them, get this course recognized, get into to continue that very amazing, inspiring effort.
Terrific. And with that course, Andres, did you actually physically get to go explore in the Amazon and work with patients?
Yeah, so during the course, we give some classroom teaching about some tropical diseases. I was able to give a talk about Chagas disease, cryptococcosis, and toxoplasmosis. My colleagues also were doing some similar work with leprosy and testing immigrants. And we had the fortune to do rounds in the hospital. We rounded with the local physicians, Dr. Casapia and Edgar Ramirez, where we were able to evaluate some patients and actually learn and be part of the group that were part of the course and learning through those cases.
I see, Andres. Speaking of Chagas disease, you mentioned that. Can you explain to the audience, Andres, what is Chagas disease?
Yeah, Chagas disease is a parasitic infection caused by a parasite named Trypanosoma cruzi. It's a zoonosis. It's transmitted by some vectors, the kissing bugs, that is present in a lot of places in Latin America. There is a cycle that goes in the nature among different mammals. But some humans, when they get in contact with this kissing bug, they can get bitten by the bug. Usually, the bug defecates, and in the feces, there are a lot of these parasites that can enter the body through the injury of the bite. And that's the most common form of transmission. Although you can also get infected through blood transfusion, organ donation, also from mom to baby, as a vertical transmission is another well described, and an oral transmission as well is another form of transmission, especially if you have contaminated food or water. And essentially, the parasites can very rarely present as acute infection, can cause a flu-like symptoms. So people develop fever. You can have swelling at the time of the port of entry of the parasite. In kids, is not uncommon to have unilateral palpebral edema, something that we call the Romagna sign, that can be characteristic of the acute infection in children. You can also see in adults, but it's less common. That swelling can be seen in other places of the body. You also develop fever. And then when that happens, people go into an undeterminate asymptomatic phase where they don't have any symptoms, and people can continue on that stage for years until you have the manifestations of the determined form, which can be cardiac, digestive, or both cardiodigestive. And so people develop cardiomyopathy, also thromboembolisms is common, arrhythmias with sudden death, and strokes, unfortunately, are kind of the main drivers of morbidity and mortality in that population. And so that's kind of overall what Chagas disease is and how it manifests clinically.
I see. And what is the prevalence of this in South America, Andres?
Yeah, there is different prevalences, different countries. There are countries where there is a high prevalence. For instance, Bolivia, there is a lot of population also affected in Argentina, Brazil, and Mexico. But there are a lot of countries in throughout Central and South America. Chagas disease is a disease of poverty. It affects the more marginalized populations, populations that
Hmm.
don't have access to health care, population that they don't have proper housing or food safety, and so they're in proximity. Rural population, especially when they are more in proximity to the vector or to the cycle that goes into some mammals that get in contact with the population.
I see. Very interesting because we rarely see this in the United States unless it's like travelers, etc. But what percentage of patients that get Chagas disease develop the cardiac manifestations that you mentioned, like the myocarditis, arrhythmias, cardiomyopathy, etc.?
Yeah, so there is a good proportion of patients with Chagas disease actually living in the United States, especially migrants coming from endemic countries. And so there is estimation of 300,000 people living with Chagas disease in the States. Probably will be lower if we consider that maybe an overestimation of the numbers. And so to answer your question, yes, we actually studied that and we did a systematic review and meta-analysis looking at, the degree of progression in people who have indeterminate form that goes into the cardiomyopathy form. And we estimated that close to 2% of people every year advance to develop cardiomyopathy, and that percentage is cumulative.
Hmm.
So by 10 years, you can expect, 10 or more people developing cardiomyopathy. And so it's a striking number, and obviously early recognition becomes very important
Hmm.
to try to prevent that progression.
Okay. And is there any treatment for Chagas disease, and what is the prevention?
Yeah, so to start with prevention, obviously, is try to, you know, combat poverty. Have these people that are living in very marginalized areas to have better housing, better access to healthcare, safety around food, and obviously try to decrease the contact with the vector. And so a lot of vector control measurements actually are able to decrease and prevent a lot of these transmissions in those areas. And there is countries with a very successful campaigns for Chagas control, like Uruguay, who
Mhm.
were able to eliminate the disease just based on effective vector control. And we do know that's been very effective. You try to obviously prevent the vector to enter the houses with fumigation, some repellents, and these campaigns. Also, perinatal transmission can be prevented if you screen the mothers or women of childbearing age and you treat them. That way, you can prevent some perinatal transmission as well. For the treatment, we do have available two antiparasitic drugs, besnidazole and nifortimox,
Mhm.
that are available and to treat the disease in any stage, either acute or chronic.
I see. Okay, great. Thank you for sharing that, Andres. So, for those of us that do some volunteer work in Africa, in some of these African countries, they have what's called African trypanosomiasis or sleeping sickness, which is transmitted, as you know, from the tsetse fly. What's the difference between that and Chagas disease?
Well, they have the same genus, so they're both trypanosomes. They probably have common ancient roots and ancestors, but they are very different. They have different geographic distribution.
Hmm.
They have different ways in which it's transmitted. They have different vectors. Also, different clinical manifestations. There is two types of the African trypanosomiasis: the eastern and the western forms, and they usually tend to affect the brain and cause some form of encephalitis, which is a little bit less common to see with Chagas disease. And they do have also different forms of treatment and diagnostics. So even though they share some name, they're very different entities.
I see. I see. Going back to my earlier statement, how, everything wants to either kill you or swallow you in the Amazon. Can you tell us a little bit about what is the Oropouche virus and what are the causes of it?
Yeah, it's interesting because infectious diseases are so dynamic, changing field that we do have new strain of infections coming up every year, as you have seen, and we all have experienced through the years. And so when I went to the Amazon, I started hearing from my colleagues there about this new outbreak of Oropouche fever, type of arbovirus. It was transmitted by mosquitoes as well, and was having some similar manifestation to dengue. The clinical presentation was very similar in some regards. And so it's interesting because these regions where you have cities or where humans are living and they're in proximity to the cell body region, you can have those spillovers of viruses that circulate usually in the jungle, but then it can jump to start affecting some humans. And unfortunately, we have seen these spillovers in a number of different viruses, especially in Africa. But the Amazon obviously becomes a region where these tend to occur as well, and it can be prone, obviously, to develop these new outbreaks. So obviously, the colleagues there and some surveillance systems, they have seen obviously a dengue really manifesting profoundly, as we have seen throughout Latin America and the rest of the world. We have seen explosive numbers of dengue due to a number of different factors. And so that tribe also was recognized when another circulating virus in the Amazon, and one of them was the Oropouche, where some scientists in Brazil and also in Peru were able to identify it and start to
Hmm.
describe the phenomena a little bit more in detail. Even though when I went to the Amazon back in February, this was very novel to us. By the time I came back, and I was obviously updating my colleagues here in Colorado about that virus, a few months later, we're starting to hear some news about some people affected in Cuba, and actually some reported cases in the
Hmm.
United States of travelers coming back from Cuba and actually from the Amazon as well. And so it gets you realize that when you are in contact with people that are at the front of a lot of these potential places for the spillover, you're able to detect a lot of these viruses that can obviously become more global and be transmitted in a larger scale. And so that's what's interesting. So yeah, the Oropouche virus is still a nature of investigation. It tends to have a little bit more prolonged symptoms. So it has a little bit of the dengue-like symptoms. People present with headaches, fever, malaise. The headaches are kind of very, very key feature in that infection, and the headaches tend to be prolonged. Their description of this virus causing encephalitis. So a number of people might have a component of encephalitis that could explain that prolonged headache characteristic of the infection. And there's an interest too because there is some concerns about perinatal transmission as well, and the hypothesis that maybe this
Mhm.
virus can be linked to some congenital anomalies, as we saw with Zika virus. I
Hmm.
don't think it's been proven yet. We still don't know. But there are some few description of cases in Brazil where they saw some anomalies, and that is a nature of investigation.
And how do you diagnose the Oropouche virus?
Usually through PCR, and that's probably the most common way. And if you are in the right window, you're gonna be able to detect the viremia enough. That's another place where we're interested in studying with our colleagues in Peru, is that to see how soon you start to detect the PCR and how long it will remain positive. You can also rely on serology, so you could try to do IgG and IgM as in other arboviruses.
I see. Have you encountered any cases of this in the US?
We heard about a case that actually was diagnosed not in our main hospital, but in our safety net hospital, Denver Health. They got a case from a traveler coming back from Cuba that was PCR positive and actually had
Hmm.
some pleocytosis, so there was some small degree of encephalitis.
I see. And is there any treatment for this novel virus?
Unfortunately, not. It's only supportive treatment at the moment.
I see. I see. All right. Another reason for me not to go to the Amazon, Andres.
Yeah, well, when we traveling, we always, as a travel clinic director, we always advise, to seek counseling and advice on travel clinic. And this a lot of these viruses can decrease the exposure of them through some repellents and some measures that could avoid, those exposures.
Great. On that note, Andres, what was your experience like as an infectious disease doctor during the COVID peak?
Yeah, it was overwhelming. It was a very stressful time. We were faced with a lot of uncertainties. As with any new infection outbreak, our desire was to know more, try to get as many information as we can from the nature of the infection. And so I remember back then trying to just make sure that we identify the right clinical manifestations, make sure that we knew the right diagnostic tests for the infection and potential, initial empiric treatments. That's kind of what it goes through our mind whenever we face something new. In our advantage, we always try to frame a lot of these viruses in a similar fashion with
Hmm.
something that we knew before. Another respiratory virus, for instance, or another arbovirus that can help us navigate a little bit of those uncertainties.
Thank you for sharing that, Andres. Just shifting gears a little bit, what's the biggest surprise you've had in the last few months or years
Surprise.
in ID, in infectious disease?
Yeah, I think I can name few. Surprises can be, looking at an infection that you know well, but maybe manifests differently. And so it really puzzles you because it's not the way you used to see that infection or the manifestation. I remember a case that I saw a few weeks ago where I saw a patient with pneumocystis jirovecii pneumonia and also disseminated herpes simplex infection, and she was otherwise a patient with an immunologic condition on rituximab, but I couldn't grasp the that profound degree of immunosuppression to explain those two opportunistic infection causing so much problem. And so it's interesting because in medicine we're always learning, and despite of having decades of experience, we always get puzzled by how this infection manifests differently. And other surprises have been, trying to monitor the flu cases that we have concern that they can become a little bit more transmissible, especially now that winter is coming. We also have in our minds, how COVID will manifest during this winter time as well. When I went to Africa, actually to Zimbabwe, a few weeks ago, we were able to discuss with the group there about the mpox, the new clay, the clay one, that also has made the news and is also a concern. I know that just a few weeks ago, the first case was diagnosed and detected in California of the clade one, because we know that we
Hmm.
we had a number of those cases of the clade two 1 or 2 years ago, and so that's kind of what it comes to our mind and surprises every time. And there is a febrile illness going on now at the Republic of Congo that nobody knows what's going on. So that's also kind of surprises us because it gives us a little bit of anxiety because we don't know exactly what's going on
Hmm.
there and what we're dealing with.
I see. That's very interesting, Andres. Having said that, how do you continue to learn and stay up to date in your field?
It's very challenging. I mean, our field is very overwhelming. We, as in academia or in an academic center, we try to specialize a little bit, try to kind of have an area where we do know more a little bit. So I tend to be involved more with tropical medicine or tropical related infections and fungal infections. other colleagues may be more specialized in other areas, so we can help each other. Other than that, obviously, we try to learn from our patients. Each case can teach us something new. We attend lectures regularly where we listen and learn from our colleagues on different important topics. Social media has become also a place where we share knowledge and share discussions about new articles, new evidence that comes to light that may change management. We also have seen the venue where colleagues may share difficult or challenging cases where we can learn from each other experience. That's been a place, very important place where we learn. With WhatsApp and this other, you know, social media communication, we try to connect with our colleagues in other centers where we obviously remain available and open in case we have questions. Occasionally, we also had to go back to a textbook, try to refresh our memory in a particular theme or topic. Have Up to Date also is another great resource for some background or framework for a particular theme or topic.
What are some of the things that excite you the most right now in this specialty?
Yeah, there is a lot of work to do. My passion lies on global health and health disparities, trying to make sure that a lot of these marginalized or people living in poverty may have better access to healthcare that may decrease the burden of a lot of these diseases affect those population, and that's what a group of us have developed a little bit of clinical research to tackle those disparities. You know, as any doctor, I think we get rewarded when any of our patients are getting better, and even though our contribution might not be big or can be small, but that's where we really thrive, and is seeing our patients get better, improve, being discharged from the hospital, uh, seeing those smiles. I think that's where keeping us moving forward.
Great. Andres, what are some of your interests outside the hospital? How do you like to decompress?
Yeah, obviously try to spend time with family is important for me. I have two little daughters, and trying to have some dedicated quality time with them is something that helps me disconnect. Um, Also have some personal hobbies. I like to swim. I also like to bike. I have a treadmill at home where I can exercise as well. I used to play soccer. I injured my knee, so I've been able to play soccer anymore.
Uh,
And all other hobbies too. I've been learning a little bit of photography too over the last couple of years. So that's been also another place where I can uh, disconnect and trying to learn another skill that is no medical related.
I see. I see. Great. Yeah, photography is a great hobby to take on. So kudos to you.
Thank you.
All right, Andres. Well, listen, maybe one day I will have the courage to go to the Amazon as long as you go with me. And maybe one day you can join us on our medical mission to Ghana. We'd love to have you join us.
Absolutely, absolutely. I think we try to plan both trips.
Definitely. Well, thank you so much, Andres, for your time and being a guest on MD Roundtable. Keep doing the great work you do over at the University of Colorado and in the Amazon, okay?
Thank you so much.
Pleasure. Have a great night.
You too.
Folks, if you enjoyed that episode, don't forget to leave a review of MD Roundtable Podcast and don't forget to subscribe. Also, if you want to reach out to me with any comments or questions, feel free to go ahead and email me at Dr. Ted Thatchencarey at gmail.com. Once again, Dr. Ted Thatchencarey at gmail.com. I will also leave the email contact in my show notes. Thank you again for joining me. Have a great day.